Are you wondering, why do I have IBS all of a sudden? Struggling with digestive symptoms, upset stomach, bloating, etc.? My name is Dr. Taranella, and in this video, we're going to look at some things you can do to narrow down where this is coming from, why you have these symptoms, and what you can do about it. So if you're interested in this type of information, click on the like button and don't forget to subscribe to the channel to get more videos like it. Now we're going to look at in some detail why you might have IBS all of a sudden. Many people ask the question, why do I have IBS all of a sudden? It's their experience that they didn't have IBS and then all of a sudden now they do. Why the sudden change? They question, how did this happen? What are they doing differently? Is it a certain food that I'm all of a sudden sensitive to? Is it some kind of change in my diet or something my body's reacting to? And because it seems to come on all of a sudden, they think it's something that changed in their body. So how can you figure this out? Like many health conditions, the actual problem started way before you became conscious of it. Before you started having symptoms, there were things happening in your body that maybe you weren't paying attention to, or there was nothing really to pay attention to. It was happening on a subclinical level without your knowledge, sort of occurring in the background, and you don't have any symptoms. Then when those symptoms do appear, they're sort of more intense and seem to be coming out of nowhere. However, in other cases, it really does come on all of a sudden. And in these cases, there's a more clear connection to something that they did, such as having a gastroenteritis, some kind of bug from food poisoning, or just being sick, travelers, diarrhea, or exposed to someone that had the flu and it affected their digestive tract. This is occurring with some people with COVID-19. Not all patients with COVID even have digestive symptoms, whereas other people predominantly do have digestive symptoms. So other viruses and bacteria can do this as well. Having a persistent GI symptoms, upset digestive tract, diarrhea, etc., after an infection is referred to as post-infectious IBS. And this is the predominant reason why people actually have IBS. So whether you got IBS all of a sudden or you had it gradually, knowingly, and it came on kind of worsening of your symptoms over time, knowing why you have it and whether or not it's a infectious source can be very helpful. So because it's the most predominant form of IBS, it really doesn't matter if it came on all of a sudden or came on over weeks or months or years and gradually got worse. There is an actual test for this, and testing for it, whether you got it from an infectious source knowingly or not, it can be helpful because it does help us determine how to treat it. So this test is called IBS Smart. Most bacteria that cause IBS create a toxin known as cytolethal distending toxin B. So that's a mouthful, but it's referred to as CDTB. And when that toxin is secreted, your immune system is going to create an antibody against that. And that antibody is known as anti-CDTB. And as your immune system is attacking this toxin and the bacteria that are present, in some cases it creates antibodies against important proteins that hold your digestive cells together. And the proteins that do that, there's different ones, but one of the important proteins is called vincellin. And when that protein is damaged, the immune system can also create, when it's trying to fight off the bacteria and fight off this distendin toxin, it can also make antibodies against that vincellin. Because that's part of the proteins that hold your digestive cells together, it can lead to a lot of tissue damage and nerve damage in your digestive tract, leading to a lot of the symptoms of IBS. When your immune system is attacking the toxin, it creates the antibodies, and that antibody is known as anti-vincellin. It is this damage and ongoing low-grade infection that leads to a lot of the digestive symptoms, and it also makes it difficult for the body to actually fully recover and repair from this damage. The test actually looks at the anti-vincellin and anti-CDTB antibody. You can have both or one or the other. Both of these would suggest that part of your problem is coming from this post-infectious IBS scenario. Now, if one of them is positive, you may have a different treatment than if both of them are positive, but it still helps inform what's going on in this process. So what do you do? Well, for starters, if you have IBS coming on all of a sudden, you might want to utilize this test to inform you on what is actually going on. Now, as I mentioned, this post-infectious IBS can come from viruses, parasites, and other sources as well. This narrows it down to bacteria, and it also tells us how much damage is occurring in your digestive tract. Now, if the test is negative, it does tell us that it's likely not from bacteria, but This is only one protein of many that could be damaged during this process. Just because its anti-insulin is negative doesn't mean you don't have damage. So it can be helpful in the positive. It's going to really tell us what's going on, but it doesn't inclusively tell us all of the problems that could be going on. So in other words, it can miss some people that have IBS for bacterial reasons. It can miss some people that have damage going on in the intestines and their bodies just aren't making an antibody to that particular protein. The test is only looking for that particular protein, and it's only going to show up positive if, one, there's damage to that protein, and more importantly, two, if the immune system is actually attacking that protein. So you can have damage going on if the immune system doesn't attack that protein. It may be negative. Still, doing a test like this or something like this helps us rule things out and rule things in to narrow down where your treatment focus should be. It's common for people with IBS to struggle, and these emerging tests can really help fill in some of the gaps of our knowledge on what's going on in your particular situation. Not all IBS scenarios are the same. Most of them do seem to be coming from an infectious source of some kind or some kind of chronic damage that your body needs help supporting or healing. Just randomly taking antimicrobial agents, either antibiotics, antifungals, or herbal things, can actually make things worse. In the case that you choose the wrong one, you can make another infection more problematic. So if you take an antifungal and you have a bacterial issue, it can make the bacterial issue worse, and vice versa. So it is important to test and kind of narrow down where the problem is coming from. Tests like this can be helpful in narrowing that down so you don't have to do as much guesswork. Okay, that should help you understand why do I have IBS all of a sudden. If you do have separate questions on any of the topics covered, please drop it in the comments section. I may do a separate video. At least I will try and answer your question to the best of my ability. If you like the video, please click on the like button and subscribe to the channel. Thank you again for watching. We'll see you next time.